Hello, I am Dr. Kilvin, and if you have a bunion, I'm going to teach you a very simple way to correct it, which you can even do at home. I'll show you how to make a functional bandage to improve the pain, the alignment of your big toe, and improve the bunion. Don't forget to leave your thumbs up, subscribe to the channel, and comment below which city you're watching this video from. Comment if you have a bunion or not, and now let's learn this technique. The only two things you'll need are a bandage and scissors that you have at home. Doctor, where can I buy this bandage? It can be found in sports product stores, orthopedic products, and if you want to buy it online without leaving home, I'll leave a link in the description of this video for you to get your bandage. The first step is to take off this sock I'm wearing, and then I roll this sock like this, making a kind of toe separator to place between the big toe and the second toe. By doing this, you'll be opening the big toe, putting it in the correct position so you can apply this bandage. Now you'll measure the bandage from the middle of the big toe to the middle of your foot. I've already cut my bandage to save time, and what you need to do is round the corners of the bandage because it will be more comfortable for you. To peel this bandage off the little paper on the back, I simply tear this paper, and then after tearing it, I can remove it to use my bandage easily. Now I stick the bandage right on the big toe, smoothing it down to make it stick well. At this moment, I can remove that sock I used as a separator, and now you'll notice that when I pull, I can control my toe. See, my toe follows all of this. Then I pull towards the heel with this bandage, pulling the paper along, and I stick this bandage here. Done, I stuck my bandage for the bunion. Now you notice that my big toe is more open, freeing up space in the joint, correcting this alignment. Now you give a massage right in this area where I'm passing my thumb. This will be done on your foot because in this area there is a muscle called the abductor valgus, meaning this muscle opens the big toe. So what is a bunion? We have two muscles here that close the big toe. We call these muscles the adductor valgus, while we have another muscle, which is the abductor valgus, the one I massaged, but it is only one, and it is against two. So the abductor valgus, being alone in this, always has to be stronger than the other two to overcome the force of these two that are trying to close the big toe. For this not to happen, we need two things. The first is to stretch the adductor muscles to prevent them from pulling the big toe inward, and the second thing we need to do after stretching these muscles is to strengthen the abductor valgus, the one that will open the big toe, correcting the alignment in the case of a bunion. Another thing that keeps the adductors shortened, closing the big toe even more, causing even more bunion and worsening the whole situation, are tight shoes, inappropriate shoes. This image here shows the x-ray of a barefoot foot compared to a foot wearing a pointed shoe. Notice how this type of tight shoe ruins your feet, worsening your bunion even more. To treat all this, you need to use a shoe that is a little wider at the tip, shoes that respect the shape and anatomy of your feet, and besides that, obviously, you need to avoid those pointed shoes, high heels, ballet flats, flat shoes, dress shoes, tight shoes, because all of this will worsen your bunion day by day. So you've already learned how to make the bandage, I talked about the exercises, I talked about the shoes, and for you to learn which are the best exercises to treat the bunion and which are the best shoes to solve this problem, I reveal all of this in this video here. To find out which exercises and shoes are best, just click on this video here and I'll see you there.